So sort of talking about sort of the practical aspect of this, even going on a carnivore diet, some people can have different problems, especially with like autoimmune issues and things like that. What are some of the carnivore foods that actually can be problematic?
Yeah. So, I mean, this is a huge topic, Anthony. So, I mean, the simple fact is like this is not an ideology. People think, oh, you sometimes you recommend a carnivore diet for a patient. It's an ideology, you have anti-vegan agenda. No, that's just a load of crap. It's absolutely nothing of the sort. So it comes down to science. And what a lot of people on carnivore diet get really upset at, well, not really upset, but they get surprised at and maybe a bit disappointed, a little bit sad, is that when I say there's a bunch of foods that are commonly consumed on a carnivore diet that is also pro-inflammatory. So just because something is an animal food does not automatically make it safe for everyone, or does not make it healthy or non-inflammatory for everyone. So my favorite study to illustrate this point, favorite condition, is something called eosinophilic esophagitis. Now, this is based on the premise that we use this as a model of inflammatory bowel disease. And as you know, the inflammatory bowel disease is a condition, a type of a condition affecting the gastrointestinal tract that significantly increases the risk of most every other autoimmune disease. Misery loves company. If you've got inflammatory bowel disease, we won't go through the mechanism right now, but your risk of developing other autoimmune diseases is increased greatly. So the principle is that if you've got this, so sorry, I've lost my train of thought there. I've got two avenues. Which way were we going?
So you were talking about different pro-inflammatory.
Oh, yes. Yeah. So eosinophilic esophagitis. So we'll come back. So eosinophilic esophagitis is a form of inflammatory bowel disease, but it's lovely because we can actually biopsy it. So we can stick a camera down your throat, take a small sample of tissue and have a look at it. And we can say, yes, that's inflamed. You've got all these inflammatory cells. Now, eosinophils is a type of white blood cell. We've got 5 different types of white blood cells, and we don't usually appreciate the fact that autoimmune disease can be impacted by probably all 5 types, but we can measure eosinophils and we can assess this inflammatory bowel disease, and we can assess the progress much easier, or this inflammatory esophageal disease, much easier than we can the traditional Crohn's disease and even ulcerative colitis. And we've got some empirical studies where they said, well, what happens if we just cut out these foods? There's a certain set of foods, and they call it the 6-food elimination diet, and confusingly, different studies have a slightly different set of 6 different foods, but that's all right. But I mean, they're generally the same. And one study demonstrated that when you put people on the 6-food elimination diet, about 73%, about 3/4 of them actually induced and sustained a prolonged remission of the disease. Basically, I don't know if you could call it a cure, but remission is pretty much the disease activity was not detected just by cutting out these 6 foods. So then the question is, what in God's green earth were these 6 foods? And I'm afraid to say that it included dairy, very provocative, especially milk, eggs, fish, seafood, nuts and seeds, which would include coffee. Now, I know for a fact that a number of the carnivore patients that come to see me are consuming at least some of those foods. And when I mention that, and they're usually in shock. Now, we can do a blood test, something called eosinophil cationic protein, which is a blood marker for basically the immune activation of eosinophils. And this is a very good metric that we can measure in the blood that tends to respond to diet quite well. So what we usually do, we usually go through an experiment and we measure the level of eosinophil cationic protein, we trial some eliminations, and we see what we can get to improve it. But then the question is, well, once you've cut out all of those foods, that's a damn restrictive diet. Do you need to stay on a diet that restrictive? And the answer is probably not. So about 1/3 of subjects in the study who went into remission were reactive to at least 3 different foods. Another 1/3 were reactive to 2 foods, and another 1/3 was only reactive to a single food. So what that shows you is that on average, people are reactive to at least 2 different foods. So that means a singular elimination diet is not going to cut it. So if you're just going to say, I'm going to cut out these foods one at a time, then on the balance of probability, you'll still be consuming a food that is causing some inflammation, and you'll probably also be consuming that food in a higher proportion. So you may very well not be able to visualize the improvements in your eosinophilic cationic protein level or inflammatory markers or your symptoms that you'd expect. So the reality is that if you're testing for these, then you need to eliminate all of the items at once and then do singular reintroductions back over time. And so that's usually what we do. And it's interesting that for most people, dairy is actually the worst. And this is a tragedy because this is a staple of people on ketogenic diets for a long time. And I also think it's the singular most common reason why there's some people who do badly on ketogenic diets. And we can't deny that within it. While on average, we can say that people on a low carb ketogenic diet are healthier, yet that is true on average, but there is absolutely individuals who don't do so well. And I have no doubt that dairy is a major reason for that. I'll take you back to a study that they did, the English, the colonial English, out of their good-natured hearts. They were looking after the health of the tribes people in Africa, and I think the article was focused on economic productivity. So I'm obviously being very sarcastic there, but they basically said, well, look, the health of the natives is not as good as we'd like it to be. We think we can improve their economic productivity. Maybe nutrition has something to do with it. So this was done back in the 20s and 30s. And I actually got a copy. It's not indexed online for obvious reasons. It's a bit old, but I've managed to get a copy of the paper. And they actually had 2 tribes, one called the Akakuyu and one called the Masai. Now, these tribes were in adjacent areas. Akakuyu were largely vegetarian. And the Masai, at least the warrior age males, would only consume meat and dairy. So this is a perfect natural study. And also, because they were adjacent territories, they would intermix with marriage. So the genetics were very similar. So we argue that the difference between the tribes is caused by nurture, not by nature. It's caused by lifestyle, not by genetics. And what they actually found that in almost every parameter, the warrior age Masai consuming an exclusively meat and milk diet were far healthier. They had less rates of diabetes. They were something like 5 inches taller, 50% stronger. So they did hand grip dynamometry, so 50% stronger. So they were just more robust. They had less joint deformity, so on and so forth. But there was one notable area where it was, I wouldn't say catastrophic, but they were quite poor. And that was autoimmune arthritis, inflammatory arthritis, where their immune system was attacking their joints. So back then they couldn't test for a lot of different antibodies, these products that the immune system produces that attacks the body. But there's one called a pentameric antibody called a rheumatoid factor, pentameric meaning it's made of 5 different components. It makes it quite large, and that made it one of the very first ones to be able to be tested in the blood using technology even back in the 1930s. And they found that 30% of the Masai warrior age males, these weren't old, had detectable levels of rheumatoid factor in their blood. Basically, their immune systems were attacking their joints. So, and that I think that reveals a lot. That really tells us a lot that, I don't believe it was the meat that they were consuming that was causing that. I do believe it was the dairy. And when we have a look at other research, so we understand, well, the immune reactivities that can be caused by gluten consumption. Well, we know that there's cross-reactivity between casein, significant cross-reactivity between casein, which forms 80% of the protein fraction of dairy, and gliadin, which is the protein fragment of gluten that causes all the problems. So unfortunately, I think, for a lot of people, if they have autoimmune disease, inflammatory disease, if they're having problems, dairy is absolutely, can be the culprit. And it gets worse. It gets worse because we talked about food cravings before. And a lot of people When I say, well, maybe you should try giving up dairy, it's like I've just asked them to hand over their firstborn child. And you just get this sense of addiction. And the thing is, dairy contains morphine, an opiate, like heroin. Most doctors have no idea. It's called casomorphine. It's literally, dairy literally contains morphine. Dairy is literally addictive. And this should be no surprise if we think about what the function of milk is. The function of milk is to take a little creature that's feeble and vulnerable, a little baby, and grow it up as quick and as robust as you can to get as much good nutrition, as much fat and as much protein as possible as you can into it. And so to do that, you have to make it overeat. Now, given that it's not loaded with fructose or any, it's not synthesized by scientists, what solution is there to make people want to overconsume dairy or make babies overconsume dairy? Let's throw some morphine in there. Let's make it like an addictive drug. And it does a job beautifully. And here's the other thing. When we're in medical school, and I'm sure you had the same training I did, the saying was the hand that writes the script for the opiate writes the script for the laxative, because we know that morphine causes constipation. And so some people who are complaining about constipation, because what actually happens is morphine inhibits what we call the peristaltic activity, the contractile motion through the gastrointestinal tract. So dairy, obviously being an opiate that can cross-react with what we call the mu-opioid receptor, which is where the opiates will act on in the human body, that will cause constipation. That's another cause of constipation.
Yeah. And so in your practice, like obviously you're treating people with carnivore. Do you put them on carnivore yourself, or do they find you because they've been on carnivore?
It's a bit of a mix. And I don't always put people, I'm a big believer in informed decision-making, and I give patients the option. And as I said before, this is not an ideology. It's not plants versus meat. There's a lot of plant foods that some people can consume without overt adverse effects. Now, not necessarily a lot, but usually people can consume some. So if people have a preference for saying, no, I don't want to be a social pariah, it's important I live with a family, I want to have mixed meals, so on and so forth, there's a variety of reasons. So it won't necessarily be about, going on a strict meat-based carnivore diet. But if people are open to that, and I believe that they've been informed, adequately informed, and they want to make that decision, I will support them in that decision.
Yeah. And then, so you do sports medicine. So you obviously work with a lot of athletes and presumably a lot of top athletes without, disclosing, any information. How has this affected your practice in helping them? Have you gotten people onto carnivore diet? Has this improved their athletic performance and that you've seen and they've seen?
Yes.
Yeah. Full answer. Yes.
For obvious reasons. And look, some of my patients have actually come out in the paper, and there's been some media coverage of people who have, reported that their careers have been rejuvenated, so on and so forth, and that's very satisfying. But obviously, we have to respect medico-legal confidentiality.
Yeah, 100%. The reason I ask is because so many people say about carnivore diet. I was like, but you can't actually have a top tier athletic performance without carbohydrates. Carbohydrates is what gives you energy. Like you'd basically just be a slow.
Well, that's just bollocks. I mean, that's just a load of that's rubbish, nonsense.
Yeah. Well, I mean, look how slow moving cheetahs and panthers are. I mean, they're just weighed down by all that meat. They're starving for some carbs.